Hello, everyone, and welcome to part 2. I'm going to get into some quotes from the research that I found. Now, the study that spurred my urge to talk about this is from Penn State University, and this is a recent study. It is titled, Americans Will Spend Half Their Lives Taking Prescription Drugs, Study Finds. Subtitle, American boys and girls born in 2019 can expect to spend 48% and 60% of their lives, respectively, taking prescription drugs, according to new analysis. So our kids are anticipated to spend half of their lives on prescription drugs. The study also found that rates of polypharmacy, which is when an individual takes more than one drug at a time, has climbed dramatically. So it says in the 1990s, people were typically on about one drug. Now it's expected that people are about on 5 or more medications, which is crazy. And I can attest to that because I was actually prescribed, or I was going to be prescribed Topamax, and somebody that was not my physician but was in the medical field, I discussed the depression rates with Topamax, and I have a history of depression, and I have no desire to ever be in that state again. So Topamax was not a drug that I was willing to take for myself. And the response was, well, we just prescribe an antidepressant for that, which I thought was crazy. So let's just keep on piling them on. That's what the education system is doing right now. Anyway, I digress. So in 2018, prescription drug expenditures hit $335 billion. And they're projected to hit $875 billion, which is 15.4% of national health expenditures by 2026. So they're expected to almost triple by the end of 2026 or whenever in 2026. It's only a couple years away. So not only that, I'm not sure if you're aware, but medical expenses are the #1 cause of bankruptcy in the United States. So this is a huge problem as it is, not only for health and wellness, but for financial security. And to me, this speaks volumes not only about what we need to do for ourselves and our own health, but for our kids. I don't want my boys to be on prescription drugs for half their lives and spending their hard-earned money, or, God willing, we'll be able to save money for them. I don't want them to have to suffer with medical issues and be spending their money on prescription medications. Even more alarming, this study was from Harvard. And it was from 2014, so there's probably updated statistics, but the study is titled New Prescription Drugs, a Major Health Risk with Few Offsetting Advantages. So, second paragraph of the study states, properly prescribed drugs cause 1.9 million hospitalizations per year. So this is aside from misprescribing, overdosing, or self-prescribing. These are properly prescribed and taken drugs. Another 840,000 hospitalized patients are given drugs that can cause serious adverse reactions, or a total of 2.74 million adverse drug reactions every year. About 128,000 people die from drugs prescribed to them. This makes prescription drugs a major health risk. They go on to go in depth about the fact that the newer drugs are barely any more successful than older drugs, and they give statistics on that. I highly recommend checking out this study if you're interested in things like this. Let's see here. There is an article from 2022. I just took a screenshot, so I'm not sure what study this is from, but adverse drugs harm 2.7 million hospitalized patients in the U.S. annually with over 106,000 deaths. So still over 100,000 deaths for properly prescribed prescription drugs. Now, I'm not saying there's not a time and place for prescription medication. Absolutely not. However, I do think that our medical system is focused on big pharma and prescription drugs. And meanwhile, you don't even need a nutrition course to become an MD. So our priorities are skewed, which is why it is so imperative for us as the individual to have a solid, clean, healthy diet and fitness regimen. So if we can prevent some of these problems, that means less prescription drugs, less risk of side effects, better health, and less money wasted on prescription drugs. So beneficial for us, beneficial for our kids. That pretty much concludes everything. If you have any comments, please leave them for me. If there's anything that you would like to discuss or see research on, absolutely feel free to reach out. And I hope that you have a fantastic week.